Good afternoon, everybody. I'm Supervisor Angela Conley, and I'm pleased to be here with Dr. Angela Franklin, President of Des Moines University. I know others are in the audience. Dr. Adrian Henry's here, President of Mercy College of Health Science. Rob Jensen could not be here today with Erie Community College. Dr. Ian Roberts, Superintendent of Des Moines Schools, is here. And I am not sure who else. But they're all going to be here later to answer questions. Thank you also for, as I said, we're really excited to make a special announcement. As you know, most of you all know that the healthcare workforce was impacted severely by COVID-19. I really hate saying those words, COVID-19, because we all know that it hasn't left us. So if you haven't got your booster shot, please do. I just heard that from Helen Eddy this morning at our board meeting. So it's not over, but we do know that not only the nursing but all healthcare professionals took a big hit, and we suffered severe shortages. We also know that we have multiple institutions right here in central Iowa who offer a wide range of healthcare degree programs, and we know that if we tackle a problem in a collaborative way, our impact will become much larger. We also know that these critical programs are unable to expand their capacity without additional simulation availability. And today's announcement of a regional simulation lab here at Des Moines University at 3200 Grand Campus and the Regional Healthcare Workforce Collaborative is truly a groundbreaking and comes after months of discussion and brainstorming with Dr. Franklin, who originally brought this idea to us last spring. Dr. Franklin will provide details regarding the construction of the Regional Simulation Lab, but I think what truly will be impactful for our community is our educational institutions in our state are the additional goals that this collaborative intends to be accomplished. These goals include not only shared simulation, space, and instruction, but also include shared recruitment strategies, starting with the Des Moines Public Schools, that we know hundreds of our kids are eager to get into the healthcare training programs that we will provide with a path to a successful healthcare field. It also includes developing a shared retention strategy that will incent students to stay in Iowa upon graduation. And it includes finding remote training solutions for rural healthcare providers and training institutions. We also know that every education institution in our region has extremely large needs, and we know that Polk County cannot solve these needs individually. So we have asked Dr. Franklin and our partners here to come up with a collaborative solution that will address a piece of all of the needs. So I want to thank all of our partners who have committed to a collaborative process that will have a true impact on the healthcare workforce of our entire state. We look forward to building this vision and bringing in additional partners as this initiative continues to grow. As I said, this vision started with Dr. Franklin's idea for a shared regional simulation center and has grown into something much bigger by bringing partners to the table to tackle such a critical issues like recruitment, retention, and rural engagement. And I could not be more thankful for her leadership, Dr. Franklin and DMU, and all of our partners that are here today. So now I want to turn this over to Dr. Franklin and discuss the plans for this facility and remind you that our partners will be here later to answer all questions. Thank you.
Thank you, Supervisor Connolly, and welcome to Des Moines University's 3200 Grand Campus. I tell you, it's an exciting opportunity to be here to share with you on this campus and to actually acknowledge Supervisor Connolly and the other Polk County Board of Supervisors for the support that they've given us. And one thing that's really exciting about to have someone present you with a question, bring me a big idea. Bring me an idea that can support the community in a way that maybe we hadn't initially envisioned before. And people have known that Des Moines University relocated its university to West Des Moines, but this campus is a vital asset to the community and a vital opportunity for us as a university to continue to be of service to the community in a way that we hadn't initially imagined. So when I was presented with a question of, give me a big idea of what we can do and how can we bring back this campus to life in support of the community to help workforce, health professions workforce. That's in our wheelhouse at DMU, and we're really excited to be able to be here today to welcome you to this campus, to the Ryan Hall, which is a building that we will revitalize with this idea of providing a much needed service to health profession schools and others in the community who might benefit from simulation and training for the health professions. So we see this as a real collaboration. I couldn't tell you how excited I am to have partners with us, with Des Moines Area Community College, Mercy College of Health Sciences, as well as Des Moines Public Schools, to be a part of this with us. They are the first to join us as they're here today, but there are others out there that we would love to continue to extend the invitation to say, come join us, because ultimately it's about benefiting the training of students, those future health professionals. So we see this as a part of DMU's mission and vision of being a community servant, to go out and extend an opportunity to help build the pipeline. We ultimately all will benefit from those young minds, those individuals here in the metropolitan area and in surrounding communities, including our rural communities, to have an opportunity for a place for those students to go for training. So at the high school level, at the community college level, and then beyond, those individuals, those young minds will have an opportunity to come here to a facility to train. Most are not as familiar with simulation, which is a big part of medical education. Just about all other disciplines, police force, fire departments, a lot of other industry will use simulation, but it's a hallmark of what happens in health sciences education. Students learn first on mannequins. They learn in simulated environments where they are dealing with non-humans. They're mannequins that actually is a part of the educational experience. This is a facility here on this campus, Ryan Hall, where we conducted all of the simulation for our health profession students before we relocated. So this building was already designed to be a sim center. There's a whole lot more space here that we can reimagine as we start building out the space to benefit the other disciplines that may not have been at Des Moines University, but meet the needs of the universities that will partner with us here and those to come. So we will begin the process with the support of Polk County to imagine what this building could become. It will require a little bit of rethinking the layout of the space to accommodate multiple disciplines and an opportunity for us to shape it to the needs and specifications of the programs that are here today and those that are come. So we're starting with a needs assessment. We want to know what our partners' needs are for their students now, and then we'll begin designing space to allow us to, within a year, hopefully, to be able to bring the first group of students to this facility for their training. It'll be an awesome opportunity to figure out how to best schedule that with so many learners out there needing to get in, but we're excited with the challenge and the opportunity to bring this campus back to life. Many wonder what we were going to do with this campus, and hopefully today you see that we have always been a part of Polk County. We will continue to be a part of Polk County. Our clinic is still on this location, and now we'll have this campus reimagined to continue to support health professions workforce. So I can't thank you enough, Supervisor Connolly and other members of the Polk County Board of Supervisors, for the support that you're giving us and the confidence that you have in Des Moines University to lead. So we're really excited, and I'll pause at this point to allow any questions or turn things back over to Supervisor Connolly if there's a need for an additional insight.
I would just welcome any of our partners to come up and say a few words, because I know they're excited to be collaborators with us on this. And I think one of the things that I learned through this process, speaking with Superintendent Roberts, was how many folks at the Des Moines Public Schools are in need of some space. So if you want to talk about that for just a quick minute, that would be great, and others I know would want to speak too.
Thank you. Good afternoon, everyone. Certainly want to start by saying thank you, tremendous gratitude to Supervisor Connolly and the incredible vision of President Franklin when she approached us with the idea and the thoughts that she has around how we can utilize this amazing space. We jumped at the opportunity. Currently in Des Moines Public Schools, we have approximately 130 students who are still on a waiting list right now to become a part of some of our health science programs. And so I envision this partnership being one that truly sets, sort of serves as a precedent, if you may, for just an outstanding partnership around health sciences. We are poised to become, as a pre-K-12 public school system, truly a future-ready force in terms of health sciences, and we're looking forward to our role in being a part of the pipeline. So excited to be here, looking forward to the partnership with everyone present, and can't wait to see what comes of this. Thank you.
Thank you. I'm Jeannie McCarville-Kerber. I'm the Executive Academic Dean at DMAC Health Sciences and Fitness. And I want to also thank everyone for inviting us to be a partner. DMAC will continue to do simulation and expand our ability to hopefully continue with Des Moines Public Schools and expand that opportunity for them. And then as we help students explore what jobs are in the healthcare field, there are more than nurses and doctors. There are surge techs, respiratory therapists, CNAs, and a variety of other healthcare professionals that are much needed in the Polk County area and across the state of Iowa. So we are very excited, and thank you all for including us.
Good afternoon, everyone. I'm President Adrian Henry, Mercy College of Health Sciences. So again, thank you, Supervisor Connolly, and thank you for your visionary work, Dr. Franklin. You know, at Mercy College of Health Sciences, we are absolutely elated for this opportunity. We really do have a crisis, a healthcare crisis, when we think about the shortages and the wait time it takes to get into these clinics. And so if we're going to solve our challenges of today, we have to do it together, and we have to do it collaboratively. And so we are thrilled for this opportunity to put our strengths and our energies together to come up with something that will truly serve our community. So we're elated to be a part of this collaboration, Mercy College of Health Sciences. Thank you.
One thing that's important about a collaboration like this is that it takes people's willingness to engage. We often joke as we come together that we all like each other, and it works really well to have a group of individuals who have like minds and really are truly here to be servant leaders, to serve the students that we serve, to benefit the community. So I tell you, my colleagues here, we are really excited to get started with the work, and we want others to come join us. You know, those who are really interested in seeing a pipeline grow and develop for the future professionals. Our hospital system partners are waiting on us to provide them with more talent, more employees, more individuals to meet their needs as well. So we'll work collaboratively to meet the needs of the community and all that we serve. So with that,
I have one more thing that I want to say that was alarming to me when I first learned about this from these very smart people behind me. It's not only here in our community in Polk County, but we need respiratory therapists in the rural county. They learn, when I looked at this sim lab, they can do it by website, by looking at their web technology. It's just amazing what you can do over the internet, but we need so many health professionals, whether it's an operating tech, it's all kinds of things that we need, not just here in Polk County, but we'll be able to do things all throughout the state of Iowa. That's why we need our state partners and our federal partners. This is a unique opportunity that we will have, that right here is a groundbreaking idea because of all of these people behind me. And I am just excited that we're doing it right here in Polk County and Polk County government through the help of ARPA and my colleagues on the board, and hard work of Sarah and Sue, who could not be here today, that worked tirelessly putting us all together. I know there's a lot more work to do, and this is just the beginning, but I'm telling you, this is groundbreaking for our region, and I'm just really excited. We have a call with Senator Grassley's office today at 3 o'clock, so we're really beginning to put our pieces together to see, because it's just not us. We need a public-private partnership with a lot more folks involved. So I want to thank everybody for coming today, and stay tuned. It's really a very exciting project. That's all I got. Okay, thank you.
Thank you.
We're done.
thank you all for coming.